Brown. I'm one of the doctors at Clinic 51. So lovely to see so many people logging on. I'll just give it a couple of minutes just to let everyone get in. So we will keep the microphones muted just while I'm doing the presentation, and then we will stop the recording at the end of the presentation, and then you can put cameras on or microphones on, and definitely put any questions that you might want to ask in the chat. If it's all right, because it's just me and I'm doing the presentation and the chat tonight, I will come to all the questions at the end if that's okay, because I won't be able to see them. I haven't quite worked out the IT in order to be able to do that as I go along. Lovely, I think we'll start. So some of you may have met me, may have seen me. I'm one of the doctors at Clinic 51. I've been a GP for more than 20 years now. I work also in an NHS menopause clinic and as an NHS GP. Always had an interest in women's health. Recently, over the last 5 years, an interest in menopause, and more recently, an interest in ADHD, which I am increasingly aware of in the patients I see in menopause clinic and also in general practice. And I guess people on the call on the talk tonight may come at it from all different experiences. So if you're happy to share your stories at the end, then you can do that or ask more specific questions. If it's okay, I will just share my screen and I'll do a presentation, maybe half an hour, hopefully I'll try and keep an eye on the time, and then we'll leave 20-30 minutes at the end for questions. So sorry, does it read this? Lovely, so hopefully you can see that. So what we're going to whistle through tonight is ADHD in women, specifically looking at the effects of menopause and perimenopause on ADHD. We'll give an overview of how this can impact women. We know from the ADHD Foundation that 75% of the 1 million women in the UK are undiagnosed and may be experiencing poor health due to this. There's lots of other conditions that can coexist with ADHD, which we will come on to, but can include anxiety, depression, obesity, eating problems, and difficulty with work or family life. Women, and often the women I see in clinics, sometimes feel they're not quite achieving their true potential. And as they reach perimenopause and menopause, sometimes feel that the wheels are well and truly coming off. The good news, I don't want it all to be very negative tonight. The good news is that with the right support and treatment, then often women can thrive into that after the menopause and through the menopause. So what we'll go through tonight is what it is, why it's important, why our hormones can influence this time, and how also we'll go on to diagnosis and treatment a little bit as well. So what do we think of when we think of ADHD? We may think of the boys in our class that may have been wriggling at school, may have been hyperactive, but ADHD is a neurodevelopmental disorder marked by inattention, hyperactivity, and impulsivity. Outside of the diagnostic criteria, which we may see, it can also cause mood changes, emotional dysregulation, and also rejection sensitivity disorder, which I'll talk more about later. I think the name in itself doesn't necessarily reflect the experience of the women that I see, but this is a very much an evolving field, with adult ADHD only being recognised in men and women relatively recently. The prevalence of this is thought to affect ADHD is thought to affect about 5% of children and 2.5% of adults, but it is often underdiagnosed in women due to differing symptom presentations, and this may lead to late diagnosis. We know that lots of very successful athletes, politicians, actors, musicians do have ADHD, Simone Biles, Emma Watson, Michael Phelps. what attention deficit actually is a dysregulation of dopamine, which is a chemical messenger or neurotransmitter that affects our nervous system. And it helps to send messages between nerve cells. It plays a role in how we think, how we plan, and how we enjoy ourselves. In ADHD, this dysregulation occurs in dopamine. You may produce too little dopamine. You may not have enough receptors for the dopamine that you are producing, and it may be that's not being used efficiently. As it's linked with sleep, motivation, learning, and attention, then any disruption to this chemical can really have an impact on life. So stimulant medications are often prescribed in ADHD. They can encourage more dopamine to be produced or help you keep the dopamine that you have got for longer. Oh, I'm sorry, this slide it's a little bit blurry from my end. I don't know if you can see it, but it's the ADHD iceberg. So what people often think of with ADHD is trouble focusing or fidgeting. What it can include is sleep problems, forgetting to eat, forgetting to sleep, forgetting to go to the bathroom. It can include low mood, anxiety, the rejection sensitivity that we mentioned, executive dysfunction, sometimes difficulty following a conversation. There may be a tendency to perfectionism. There may be difficulty focusing if this isn't an area that you're particularly interested in. There may be over-focus in areas that you are very interested in with hyperfixation. There may be mood swings. There may be all or nothing thinking, time blindness or less awareness of time may be a feature, and it may present with difficulty staying on task. We know from a study done by the Attitude website in 2023 that symptoms in women, and there's very little research in women with ADHD, but symptoms can vary through life. So in early years, that often is the inattention in class, the daydreaming, maybe struggles with friendship. In the teenage years, that definitely can present with emotional dysregulation and time management problems. And as we start to get to midlife, then the overwhelm, the brain fog, the memory issues, and also the focus can become a real problem. The importance of recognising ADHD is this is one of the most treatable conditions seen in psychiatric clinics. And the risk of undertreatment or underdiagnosis for all people with ADHD can include increased risks of accidents, increased risk of suicide, relationship problems, and addiction. And in younger women can also include sexually transmitted infections and unwanted pregnancy. So I'm really passionate now that I've done talks for healthcare professionals on this. I think all healthcare professionals, not just people working in mental health services, need to have a role in supporting women, patients with suspected ADHD to try and get the help and signpost for diagnosis. It's just a shame the NHS waiting lists are so long, but that's another area. So the gender differences that we see in ADHD. And there's 3 different subtypes. There is hyperactive and inattentive, and then combined type. The inattentive counts for about 20 to 30% of all ADHD. This may look like not remembering things, using reminders, daydreaming. The hyperactivity, sometimes in women, that can be an internal mental hyperactivity. So talking very fast, talking a lot, needing to move, being on the go also may present with if you have hyperactive ADHD. And there is a combined type, which is about 50 to 60% of people with ADHD. Less overt ADHD symptoms, so less obvious ADHD symptoms, are less likely to lead to referral, which means that we are diagnosing 3 times as many boys with ADHD as we are diagnosing girls. The adult prevalence actually seems more one-to-one, and we definitely need more research into these differences and how we narrow that gap. Younger girls much more likely to be diagnosed with depression and other conditions before they're diagnosed with ADHD. Women also can develop better compensatory behaviours, coping strategies, masking and mitigating ADHD symptoms. There is a society expectation as women, as girls, that we should be well behaved, should be organised, we should be looking after others. And so women with ADHD often learn to hide their symptoms earlier. Doing well at school, achieving well in careers is not necessarily mean that you don't have ADHD. The hyperfocus, the people pleasing, sometimes perfectionist tendencies can be very helpful in modern society in the world that we live in, even if it's exhausting for those women to maintain. Ideally, we should be picking this up earlier in childhood, especially in girls, before any shame starts, before misdiagnosis starts, and before any subsequent problems. And a very real scenario that I often see in clinic, and some of you may relate to, is where you have children and your children may be having some difficulties in some areas. You may be thinking this is just as I was when I was a child, but then they have more and more difficulties, or they hit their teenage years and have problems with friendships, with school, with organisation, and they're diagnosed with ADHD. And then as they're going through the process for an ADHD diagnosis, then some women that I've often seen are thinking, oh, actually, I think this might be me. And then they look around in their wider family, and actually there are some other people in their family with neurodiversity. And then it all makes sense. But it's also a very tricky time, because at the same time that you are possibly unmasking ADHD, plus going through perimenopause, plus dealing with a child who may have difficulties due to neurodiversity, this is all a perfect storm. We know that genetics does account for about 70 to 80% of the causes of ADHD, but there is no single identifiable gene. And we're definitely lacking research in ADHD, and definitely in women. Almost all research up till recently was being done in men, as women were having hormonal swings and making research very difficult. And I think we do have to say, for people who say, aren't we all a bit ADHD? Is this all a bit made up? Is it all due to parenting or bad, too much screen time? That there are chemical changes on brain imaging. And in order to have a diagnosis, this needs to be causing impairment in more than one area of your life. So it's a very rigorous diagnosis process that people will go through. But this is a very real condition that really impacts both men and women in many different ways. So if we go through some symptoms in women, the inattention may be, as we said, difficulty organising tasks, distractibility, losing phones, keys, paperwork, running late. And there may be paper clutter or paper piles. You may be dreading repetitive tasks, hyper-focusing on other tasks, having difficulty being patient or waiting in line, or becoming frustrated, falling behind on work. Overall, due to maybe misdiagnosis or not being diagnosed, there may be negative thoughts overall about themselves and capabilities. And they may have a tendency to depression, anxiety, and other mental health challenges, even if those have been masked and not necessarily come to the attention of their doctors through their life. And some people talk about superpowers of ADHD. I often ask women, what do you find easy? How has this helped you in some areas of life? There may be the hyper-focus that may have led to success in careers. People talk about people with ADHD having a strong sense of justice and empathy, also being very calm in a crisis. So sometimes people are drawn to work that is high dopamine, so police, emergency work, where they are on the go, and they do appear to have be able to be very calm in a crisis. Risk-taking, often entrepreneurs have ADHD, and resilience to have kind of overcome the challenges that they may have had in life, creativity, thinking out of the box. There are many co-occurring conditions, which was really interesting to me when I started looking at this in a bit more detail, because we often have patients in general practice coming in frequently with what seems to be lots of unrelated problems. We do need more research into how these are linked and how this all works together. In terms of mental health co-occurring conditions, that can include treatment resistance, anxiety and depression. They may have had lots of antidepressants or talking therapies with little success throughout their life. I often ask about PMS, PMDD, or postnatal depression. So how have hormones affected you through your life? Then women may have been diagnosed with emotionally unstable personality disorder, that's EUPD, or had episodes of self-harming. They may have had substance or alcohol misuse, and sometimes trauma leading to complex PTSD. There are physical symptoms that are known to be associated with ADHD, such as Ehlers-Danlos syndrome. So I realised I put a few abbreviations in here. So hypermobility or Ehlers-Danlos syndrome are well known to be associated with ADHD, and palpitations, dizziness, and POTS, which leads to POTS is a condition which can lead to palpitations, dizziness, and was seen quite often after COVID due to autonomic dysregulation, which is linked with ADHD. Women can sometimes develop or have histamine intolerance, mast cell activation syndrome. We definitely need more research into these areas. And there is a known link with asthma, obesity, chronic pain, chronic fatigue syndrome, and migraines. So often when I'm seeing a list of similar conditions for women that come to see me either at Clinic 51 or in general practice, then sometimes I'm talking or suspecting possible ADHD. So what happens in perimenopause and menopause? So perimenopause, as we know, is the phase leading up to menopause marked by these hormonal fluctuations. And menopause technically is 12 months after your last period, typically around the age of 51. Other symptoms you can get: hot flushes, sleep disturbance, mood swings, and cognitive changes or brain fog. Women often report unmasking or emergence of ADHD symptoms during the menopause. We also know that 1 in 6 women develop depression for the first time in perimenopause. And we also know that the suicide risk is greatest in women between the age of 45 to 55. We really need to be supporting women in all different ways in this time. Another attitude study of 1,500 women with ADHD symptoms in 2023 reported that 94% reported worsening symptoms during perimenopause. 50% of those had life-altering symptoms. 83% of women developed what seemed to be new ADHD symptoms, or maybe unmasking symptoms. This is also, as we often talk about in clinic, a very difficult time with lots of stress for a lot of women. We may have teenagers, then they may leave our homes, we may have empty nest syndrome, we may have increasing work responsibilities, caring for aging parents, there may be relationship stress. So all of this can create a lot of difficulty with mental health. I'll briefly go over, I'm just conscious of time, the hormonal changes of ADHD. What we know is that estrogen can also affect our emotional regulation. It can affect our memory, our executive function, and our circadian rhythm, so our sleep pattern. Estrogen concentration generally is high and steady in the reproductive years, and when estrogen levels are high, generally ADHD symptoms are low. Women often find during pregnancy their ADHD symptoms are not as bad as previously. In that stage before our period, sometimes ADHD symptoms can worsen, and then in perimenopause, then your estrogen is going up and down all over the place, often leading to dysregulation of dopamine as well. So diagnosis of ADHD. So the hormonal changes may mask or mimic ADHD symptoms. This sometimes complicates diagnosis. So women may have thought, possibly I have ADHD, and then periods start to change, they have hot flushes. Oh, I think maybe it is perimenopause. There's so much overlap of symptoms. It may be helpful to see an experienced mental health professional or psychiatrist to diagnose ADHD if this is causing difficulty in areas of life. And often we will work alongside psychiatrists to optimise hormonal and mental health. The NHS waiting times are a barrier to diagnosis in some areas of the country, and more than 5 years on the NHS for an adult ADHD diagnosis. And what are the advantages? This is something I have talked about with patients and looked into. I think there is sometimes a diagnosis of ADHD allows vindication. You can understand your difficulties better and start a better journey in this next chapter with self-care, with kindness, with compassion towards yourself. There can be a grieving process for women, you know, sadness of the struggles that they may have had up and down through their life and the negative self-talk that they may have got into the habit of. I have talked with patients sometimes or raised the issue of possible ADHD, and sometimes that's been a relief that not just that, you know, not just that person is thinking that there may be an underlying issue that may join all the dots. This is a slide from the ADHD Foundation, but just kind of going through which symptoms can be due to menopause, which can be due to ADHD, and there is some overlap with the focusing, the tiredness, the forgetfulness, anxiety, mood changes, and sleep issues. In terms of diagnosis, then if booking, or if anyone tonight was thinking about booking for an ADHD assessment, I would recommend a psychiatrist who can diagnose, but also prescribe, or at least take you through the pros and cons of prescription. We need to make sure there are often people, women, children, men, go down the private route for a diagnosis, which can be very, very expensive. I think we need to, or people need to make sure that they are compliant with the NICE guidance in terms of the reports that are sent back to your doctor. Also, to speak to your doctor if you're considering going for a private referral about whether they would be happy to take on shared care agreement. This is very much variable depending on the practice and the area of the country that you live in. If you were considering starting medication for ADHD, I think it's a good idea to speak to your GP in advance of that to see whether they would be happy to take on the prescribing. So in terms of diagnosis, the psychiatrist would exclude other reasons for the symptoms and hopefully speak to people in your life that may have known you throughout your life about difficulties that you may have in childhood. In order to fit the criteria, these symptoms may or should have been present before the age of 12. And also they do need to have an impact on work, home, relationships, and be pervasive in these areas of life. So this is different from having ADHD traits. I won't go through all of this slide. We will put the recording available, but this is, if you do go for a diagnosis, this is what this should cover. This is what your doctor or GP would be looking for it to cover. So this will take, for a good diagnostic assessment, at least 2 hours. In terms of treatment options, so there are stimulant medications and non-stimulant medications. Sometimes women will describe when they start ADHD medication, they can say it was like putting the glasses on for the first time, or like someone had switched the lights on, and there is this calm. So it can be a very positive experience for the right person with the right dose, with the right support. Stimulants are effective for around 80% of people with ADHD, so this is a better response rate than we get with antidepressants. But there can be a little bit of trial and error. Usually psychiatrists will start on a really low dose and actually quite quickly titrate the dose up to a treatment dose. But multiple studies have shown the short-term beneficial effects of ADHD medication on outcomes, including accidents, including suicide, in younger people, including education and substance misuse. So the first line for adults is usually a stimulant and a long-acting stimulant, because they work to boost and balance the neurotransmitters for your dopamine. They also can improve your mood, they can make you calmer, less irritable, although they can worsen anxiety. It's really important that these medications are carefully considered. We need to look at, if this is a later diagnosis, your cardiovascular risk, weight, blood pressure, and check for any underlying problems or thyroid disorders. It is really important alongside medication to also look at healthy habits. So diet, nutrition, exercise and fitness good sleep hygiene are really important. Often to lower, to manage dopamine, to reduce stress hormones, things like meditation, yoga, reducing our screen time, spending time in nature, breath work, journaling, mindfulness. So things that we should all consider, especially around midlife and around menopause, are particularly helpful to manage ADHD in an alternative way. And there are apps you can get to help with organisation, so calendars, timers, reminders, software that blocks scrolling for too long. Some women will consider having an ADHD coach or having a therapist, which can be really helpful. And I think also if there are issues that are starting to arise at work, in midlife and menopause through ADHD, then speaking to work about flexible working and reasonable adjustments can be really helpful to just give that time to catch breath, to have a plan, and to allow possible treatment or lifestyle measures to start to work. So if women are not already using medication to treat ADHD, then the introduction of hormone replacement therapy may alleviate some of these symptoms of menopause and perimenopause and potentially improve ADHD symptoms. So in women that I see, sometimes it's a good idea to try hormone replacement therapy if there's no reason that you can't take that, and if you're happy to try that. We don't have a lot of research into this, but it can sometimes help with executive function. It can also reduce menopausal symptoms, improve sleep, so indirectly sometimes helping with symptoms. Really important to keep a record, if you can, of how you're feeling before and during treatments, just so you can really be mindful of the difference and the impact that that's having. I'll just take you through. This is a fictional, but not typical, but a patient that we may see in Clinic 51. So a 42-year-old woman with perimenopausal symptoms. And when we speak to her, she has a history of PMDD. She has a history of postnatal depression, anxiety. There's been some intolerance to contraceptive pills tried in the past. And there is a diagnosis of hypermobility. She's had a recent diagnosis of ADHD in her child after a period of school refusal, and is now finding that she is struggling to work, struggling to focus, and there is emotional dysregulation that is starting to affect relationships. And having read around the diagnosis for her child, thinks that she may also have ADHD. So this is what's lovely at the clinic, as some of you may know, is that we do have some time to try and unravel what's going on, what's worked, what's not working, and to really spend some time coming up with a plan and sharing the options. So for patients similar to this, I would take a full history of what menopause symptoms they're having and the impact that this is having on work and relationships. And we can ask about physical symptoms, joint pain, hot flushes. We can ask about any mood changes that happened more recently. Also ask about libido, vaginal dryness, and urine symptoms, as we always would. And also asking about periods and any contraception that they're using at the moment, or any need for contraception going forward, which may alter how we would suggest management. I think it's always important, as we've said with this woman, past hormonal health is really important. Sensitivity to hormones is really important. We know in women with neurodiversity, they often have a history of PMS that sometimes will be linked with sensitivity to hormones in general and intolerance to the contraceptive pill. So I would forewarn possibly of progesterone intolerance, and progesterone is something that we use in HRT. There are ways to manage this, but it's good to have that awareness of possible problems in the past so that we can consider that moving forward. There may be, I always take a history of mental health and trauma or any previous addiction problems. And women are often coming, whether they do or don't have ADHD, to us in clinic, sometimes having a history of trauma, and that may not be recent trauma. That may be something that happened in childhood, teenage years, 20s, 30s, that as we've gone through life, pushed down, especially if we're bringing up children and life is busy, and then suddenly with the surge of hormones, with undiagnosed ADHD possibly, then this can become really difficult to push down and often lead to mental health problems. So always asking about previous mental health problems and asking about other medical conditions that may be linked with ADHD. Asking about family history of ADHD and any other relevant history. And talking about lifestyle, so smoking, how much are they drinking, and what exercise are they doing? Is it working for them? Is it making their symptoms better or worse? And how are their stress levels? We could then talk through the pros and cons of HRT. We can talk through the pros and cons of a diagnosis, and we can signpost to lots of really useful resources, which I've got at the end of this talk, which we can email on to you at the end, just to have that awareness about that as a possibility. I think if women are keen to pursue a diagnosis for them, then we do work with a psychiatrist and we can arrange the referral. I think it's important to maintain a positive outlook for the future. This is a really difficult time. Women are often struggling with so many different symptoms, but also have other people depending on them and maybe struggling with children also with additional needs. But I think maintaining continuity, having a number of different options, whether that's medication, including medication for ADHD or HRT, looking at lifestyle and appreciating the difficulties that this may have brought, but sometimes the advantages, I think women can come through the other side in a better place. So just to conclude, we know that new diagnoses of ADHD in women in perimenopause are not uncommon. We do need to help all women to manage their menopause symptoms and to feel the best that they can do through this difficult time. It is always a very individual decision regarding benefits of a formal diagnosis of ADHD, and this can be done under a psychiatrist. We may also want to treat any co-occurring conditions, both mental health or physical health. And lifestyle really matters for everyone in midlife, but especially if you are struggling with ADHD symptoms. And we need to consider the impact that this can have on people's work and also on their relationships. And sometimes getting support from specific groups, coaching, ADHD support groups can be really helpful. And I really like this that I saw on Instagram. So why do you need a label? Because there's comfort in knowing you're a normal zebra, not a strange horse. Because you can't find a community with other zebras if you don't know you belong. And because it's impossible for a zebra to be happy or healthy, spending its life feeling like a failed horse.